Well, Gaza's health ministry says hundreds of people have been killed in an explosion at a hospital. Gaza, Hamas is blaming Israel. Israel is blaming Islamic Jihad. This is the fog of war. Meantime, the Palestinian president has declared 3 days of mourning while Egypt and Jordan have denounced the apparent attack. So joining me live is the head of programs at Doctors Without Borders, Simon Eccleshall. Simon, thanks so much for your time. How many doctors have you working in Gaza at the moment?
Good morning, Laura. First, may I say that MSF is horrified by the brutal mass killing of civilians, both by Hamas and by now the Israeli Defense Force. MSF's been working in Gaza for about 30 years. We currently have about 300 local medical staff working in Gaza and about 20 international staff who are no longer working. We're actually trying to get them out of Gaza after a period of exhaustion in trying to treat mass casualties over the last 10 days.
Mass casualties, what are you talking about?
Well, at each of the hospitals where MSF is working, we've seen, the hospitals completely overrun. Typically, some of the hospitals we work at have several hundred beds or 500-bed hospital where we're working in the north of Gaza. There's currently tens of thousands of people entering those hospitals seeking refuge, seeking medical care. And as I said, unfortunately, because of the indiscriminate bombing, the relentless bombing, we've had to suspend our medical activities. And right now, we're trying to reach out and be in contact with those local staff who are, we understand, continuing to try and do their best in the hospitals and treat the wounded and injured.
So would they have been working in this hospital, let's say, that had the explosion? We don't know where it came from. Israel says it's Islamic Jihad, a misfire, and Hamas says it was an Israeli airstrike, but I don't expect you to be able to say either way there, but were your doctors working in that vicinity?
Yes, the news overnight of this terrible explosion at the Al Adi hospital is one that has saddened us deeply. We have been in contact with a colleague who was in the operating theatre at the time and said that part of the ceiling had collapsed while he was operating. MSF doesn't work there permanently, but we do from time to time provide support. Whilst we understand that there's a blame apportioning going on right now, what we can say is that throughout the week, two of the hospitals where MSF has worked have been hit by Israeli airstrikes, including an MSF clinic, and that the bombing we witness in Gaza is relentless, it's indiscriminate, it's block by block. And unfortunately, it seems that hospitals, medical facilities, ambulances are not exempted from those bombings. And there seems to be evidence that in some cases they are being targeted.
Right. So your doctors on the ground have said at least 2 clinics, MSF clinics, or at least where doctors have been working, have been struck. Is the feeling there that they were targets or were they collateral?
Listen, Laura, it's very hard to be able to voice an opinion on that. All that we can really say is that from what we are witnessing, the bombing appears to be indiscriminate. There is no safe space. There is no safe passage in Gaza right now. And consequently, the request by the Israeli forces to evacuate northern Gaza is quite ludicrous. Moving 1 million people from the north of Gaza to the south of Gaza, whilst they continue to bomb the south of Gaza, is not a choice that people can make. The lack of fuel, water, food, other facilities at the hospitals where we work, and now the absence of medical personnel means that the patients that are left behind really face a death sentence. There is no hope for them whilst the borders remain closed, whilst medical supplies are not allowed in, whilst fuel to generate electricity is also blockaded from Gaza. So we're calling for those borders to open and those supplies to come in immediately as a matter of life-saving urgency.
Yeah, it certainly is necessary. Hopefully this happens soon, but there has been no sign that the Rafah crossing is going to open anytime soon. If I could remain on the Al Ahli hospital, Simon, Any reports back from your doctors on the ground as to how many casualties there might have been there? I mean, there are varying reports from 300 to 800, but if you could give us any insight there, I think it'd be helpful.
I'm sorry, we have the same information.
Yeah.
It's really hard to be in contact, to communicate with our medical personnel. So until there's some more reliable data through, the figure that we're also quoting is that around 500 casualties. And as I've mentioned before, thousands of Gazans are looking to hospitals as a place of safety where they can seek medical treatment and perhaps escape the indiscriminate bombing. But as we've seen throughout the week, medical facilities have been attacked, and we remind the world that there's an obligation in war to protect medical facilities, and unfortunately both sides don't seem to be respecting that at the moment.
No, and we always have anecdotal reports of Hamas using hospitals as well for a safe haven for themselves. I mean, can you say anything about that?
No, we can't. Again, the people that we treat at hospitals are patients. We understand that 1 million civilians in the north of Gaza are in an extremely dire situation. To be able to comment on military presence or operations is beyond our information. But what we can say is that huge unmet medical needs are there, and it's really, as I said before, a death sentence for the people remaining unless the bombing stops, unless the supplies are allowed to come in literally today.
So what is required? And on what scale? I mean, the photos that we see out of Gaza, and it's really hard for journalists to get in there at the moment, so we are relying on a few brave independent journalists to get that information out. But it does look like very rudimentary treatment. So I imagine you need things like bandages, but more sophisticated medical equipment as well.
Exactly. You've probably heard that there's been a blockade on medical supplies imposed now for more than a week. We're seeing doctors operating on patients without painkillers. We're seeing a lack of medical supplies being available to enable burns and other trauma injuries to be treated. So what we need right now is for that border to be opened, a safe passage for humanitarian supplies, and the cessation of the indiscriminate bombing from the IDF in the north of Gaza.
And is the Australian government helping you to make these representations?
No, MSF is calling on behalf of our doctors and our patients, but we're also in touch with other humanitarian organisations that are making many of the same points. I think the UN has shared information on some of the bombing affecting people sheltering in schools in Gaza, and indeed they are calling on world leaders, as are we, to apply pressure to both sides to allow for a cessation of hostilities, to allow for safe passage with right of return for Gazans to be able to escape this blockade.
Simon Eccleshall, we really appreciate your time. Thanks so much.